Well, yesterday we learned more about the province's health care plan, a plan Health Minister Sylvia Jones says will provide services faster and closer to home. Now, the government will be investing or spending $30 million as part of the initiative to create 18 new primary care teams. They will include nurses, doctors, and social workers. Now, it also intends to expand existing family health organizations to allow up to 1,200 more physicians to join the model over the next 2 years. Critics worry this plan, though, leaves the door open to upselling some services, but the health minister insists no one will be forced to pay out of pocket.
If there are surgeries that are done that are cataract surgeries appropriate, they will be covered by OHIP. There are additional offerings that hospitals and community surgery centers provide and make available, but they are not mandatory, and they will, the core service will be covered by your OHIP.
So let's talk more about this morning live with the incoming NDP leader, Marit Stiles, joining us live. Good to see you. Thanks for joining us here. So let's talk about this, because there's a lot of pushback, a lot of controversy on all sides here. The OMA, for example, expressing some cautious optimism about this plan. If they're willing to take a run at this, do you think that there could be some potential advantages then?
Well, look, I mean, I think I'm talking to Ontarians across this province, and they really value our publicly funded and publicly delivered healthcare, and they know that there's a crisis right now. But I think Doug Ford has been misleading folks. This is a healthcare staffing crisis, and putting in place private for-profit clinics that can drag more of those staff out of our hospitals and other public healthcare facilities isn't really going to help solve the problem. It's just going to make it worse for people who need more serious surgeries and more urgent care. And you know, I think as well, you know, at the end of the day, any talk about potentially upselling or hidden fees is a concern for folks, because again, you know, we don't want a healthcare system where those who have money get one level of care and everybody else gets another.
Yeah, and it's been interesting to sort of listen to the answers, the sort of careful language you've been hearing from the government on that, in terms of like, if it's essential care that you won't be paying for, but there are potential other things that perhaps you may have to pay for. So we'll kind of see where that goes and keep an eye on this. In the meantime, Ms. Stiles, the New Democrats, of course, have long fought for eliminating, you know, for-profit long-term care homes. That's a system that's already in place here. Undoing that could be complicated. So what about seeing if this new system potentially solves problems in healthcare and then pulling the plug if it's a failure? Could that happen?
You know, I think if you look at the track record around the world, and even here in Canada, it has really shown that when you're diverting public funds, like public money, out of patient care and onto, you know, shareholders' profits, patients suffer. And we saw that absolutely in the pandemic in terms of the results, which unfortunately meant that more people actually died in for-profit facilities than in not-for-profit facilities. Why would we be expanding this kind of care? In BC, they're actually buying back. The public system is buying back these clinics. You know, it has been proven not to work well for Ontarians or for anyone, for patients. So I don't understand why we're heading down this road. And let's be clear, you know, this crisis, again, is a healthcare staffing shortage crisis. This government shouldn't be in court right now fighting to keep healthcare workers' wages down. When we have a crisis like this, there are solutions, and they exist within the public system.
Okay, I know we were trying to talk healthcare, but I know you raised some more issues with the sort of Greenbelt development here. There's also been some, you know, PC pushback this week on that. You submitted some information to the Integrity Commissioner on the Greenbelt. The Township of King Mayor Steve Pellegrini, he's pushing back against your assessment of the sort of substance and significance and timing of a meeting with a developer who owns some protected land in the township. Did you speak to him? Because he suggested that you should have spoken to him before speaking out.
You know, we have some information that was provided by a resident of Newmarket who had FOI'd documents that are actually come from the King Township themselves. So all we've done is pass that on to the Integrity Commissioner. The Integrity Commissioner needs to know all the information that's out there. And, you know, I have to say, this is a document that indicates to us that the minister's emphatic response to our questions about whether he or anybody in his government shared any information with landowners or developers before the big announcement about selling off the Greenbelt. It indicates to us that that was not true. So he has some answering to do, I think, the minister. But at the end of the day, this is an investigation that's in the hands of an independent investigator, it's the commissioner, the integrity commissioner. We've passed on that information. If the mayor or anybody else has anything more to add, they should be in touch with the integrity commissioner.
Okay, lots to still get into on the Greenbelt, that's for sure. That is incoming NDP leader Mart Stiles joining us. We can only say this for one more day as it's official. Tomorrow you will become the official opposition leader, so congratulations on that. We'll look forward to addressing you that way in the future. Mart Stiles, thanks for being here today.
Thank you so much.